Let's return to one of our top stories, the rather eventful back and forth over an attempt to block the government's double dispensing reforms. This is the reform that allows people to get certain medicines over a 60-day subscription and save money rather than 30 days. Joining me now, Assistant Minister for Rural and Regional Health, Emma McBride, herself a former pharmacist. I guess you're still qualified, so you're still a pharmacist. The scheme itself, the 60-day dispensing, what happens here? Are you still consulting with pharmacists and the Guild, or is this just happening regardless, no changes to the scheme?
What we're determined to do is make sure that 6 million Australians will be able to halve the cost of their medicines. I know as a pharmacist myself that at the moment, almost 1 million Australians are avoiding or delaying filling a prescription because they can't afford it. And in a cost of living crisis, it's critical that people can afford essential medicines that their doctors prescribe for them and that they need to be able to take.
So are there ongoing conversations, though, around any, not necessarily changes to the 60 days, but sort of compensation or other ways to keep community pharmacies going? Is that an ongoing process or not?
So what Minister Butler has announced is that the 60-day prescribing will go ahead. And in terms of support to pharmacies through this transition, from the 1st of July, pharmacists had an indexation boost of 7% for Commonwealth payments to pharmacies for dispensing. The Minister has also doubled the regional pharmacy maintenance allowance and also introduced a new transitional payment to make sure that pharmacies, particularly those in the regional and remote communities that I represent, will be properly financially supported through this transition. One of the things we learnt through the pandemic was that pharmacists should be able to do more.
Okay. I believe it's all done now. 32-28 Labor forced the disallowance vote. It's a bit intriguing here because the coalition wanted to look at the disallowance because it's a regulation, it's not a normal vote, and then it didn't force the vote, and then Labor did. It's a bit of a stunt, Labor wanting to get the coalition on the record.
Well, I think what we've seen from the coalition teaming up with One Nation is them trying to stop 6 million Australians to be able to get more affordable medicines. And in a cost of living crisis, we know that it is absolutely critical that those 6 million Australians can halve the cost of their medicines.
So what do you make of stories the Pharmacy Guild are putting forward around certain pharmacies that will reduce hours, that are looking like they'll have to close? Are the pharmacists not being honest there? What's happening?
Well, what we have done, as I said, on the 1st of July, there was a 7% indexation boost to Commonwealth payments to pharmacies for dispensing. There was a doubling of the regional pharmacy maintenance allowance. And the Minister announced just a fortnight ago that this new transitional payment, which will make sure that pharmacies aren't worse off as we go through this process, but every dollar saved through this will be reinvested in community pharmacy.